A coordinated care plan provides a great standardized tool to bring forth the important parts of a care plan for all service providers. They have input in it. The physios have input in it, occupational therapy, social work, nurse practitioners, personal support care workers, nursing. We all have an input into this, so we all know the client's goals and expectations, and we can all interact better to make that happen.
It sounds like exercise is also very important to you.
I like to walk, but it's very, very slow. And
probably the biggest change and biggest shift is talking to the patients and asking what their goals are. And I think that that's a really, really fundamental shift in that it moves the provider as a consultant in the patient process as opposed to being always the expert.
As a healthcare team, it improves communication. It ensures that we're not duplicating services and that we come together as a team surrounding the patient, trying to meet their goals.
And we're getting them all around the table to figure out, and we want you there, and you need to vocalize what your goals are. And the aim of this is to get you to be able to achieve those goals. So that's how I pitch it to them, and then they're kind of like, well, that sounds like a good idea.
Complex is not just health needs always. Sometimes it's social economical. So their housing, their family dynamics. So when you look at somebody holistically, complex needs are just a mind, body, and soul.
If you're having problems or setbacks along the way and being understood and heard, I think that only comes from a team approach who's actually invested that time with the person, time and patience, and I think that's coordinated care planning.
And often the identifying factors of somebody being complex comes through the family physician. Sometimes if they're high users of the emergency department for various needs, we get referrals from the physicians there. We also get referral from community agencies, and more as coordinated care plan is becoming more popular and utilized. We are seeing agencies such as Home and Community Support Services. We have the Alzheimer's Society do referrals. Anybody can refer a loved one, even family can refer their loved ones to have a coordinated care plan.
Referrals are made either through physicians or care coordinators or just the mere fact that patients have hospitalizations or repeated emergency visits.
The foundation is built upon self-determination, and that is a key to affect change. So if we can allow them to lead us where they need to go, we as care providers are not going to be so exhausted and scratching our heads going, well, I don't know why this isn't working.
It also identifies any barriers to care. Again, that's a great way to start some communications with the care team. We can't help a person if we don't know their barriers to care, their challenges to their care.
Doing it the other way by having them self-identify takes the guesswork out of it. And all we have to do is ask.
So there's reports from 69 hospitals across the 4 LHINs 1, 2, 3, and 4, that are all pushed into Clinical Connect. So this can be really advantage to have access to this so that suddenly when you have the patient back in your office or you're visiting them at home, you can get access to that patient information while you're there and not at a later date.
It's really powerful as someone who works in healthcare to sit down with someone and look them in the eye and have them say to you, this is what I want. And what they want may not be what you first think they want or need, but what they want is so important.
I think it just brings the essence of in-home care to its peak, right? It's perfect when that happens.